This is a journey of a 53-year-old housewife who was bedridden since many years due to rheumatoid arthritis, which had destroyed her hip joint as well as her knee joint. She faced extreme difficulty in walking. She needed support to even do her daily activities like going to the washroom, and was supported by 3 or 4 people to walk a few steps. She came to us for her assistance and to improve her gait, and we got her knee and hip x-rays done and found her to be suffering from advanced hip and knee osteoarthritis. We went ahead with a staged surgical procedure, doing a total knee replacement and a total hip replacement in a staged manner, and we were able to restore the stability, alignment as well as the movement of both the joints using technology assisted surgery. Her post-surgery x-rays revealed perfect alignment of the hip joint as well as the knee joint, and to our surprise, she had enough willpower to start walking the very next day with the help of a walker. She was quite motivated to climb the stairs the very next day and went home unassisted without any support the third day from the day of surgery. She had a decent knee range of motion. She underwent intensive physiotherapy, rehabilitation with the help of her physiotherapy colleagues, and now she enjoys the freedom of walking without any support, independent, and is ambulatory mobile, and has gained her confidence, which she didn't have for the past many years. This is the power of undergoing an arthroplasty or a joint replacement surgery for the knee and hip whenever someone is suffering from an advanced disease.